President Trump says he is cutting the cost of some of the most popular and expensive weight loss drugs on the market. In a deal announced at the White House yesterday, drug makers for some of the country's most popular GLP-1s agreed to lower the monthly price of medications for Medicare and Medicaid patients and for people who buy them directly through the new Trump RX website. To help us break down this deal, we're joined by Rachel Strauss. She's a public health care and affordability expert. Rachel, thanks for being with us.
Thanks for having me, Chris. Good morning.
So these GLP-1s, as we know, can cost more than $1,000 a month, expensive for anyone. Under this proposed plan, what are the costs going to look like now month to month for these drugs?
So it's early to tell. We know that they're talking about the initial dose being around $150 to $350 out of pocket. Still very expensive, but significantly better than what we've seen. The biggest deal here is that Medicare and Medicaid, which traditionally do not cover drugs specifically for weight loss, are looking to do this.
Let me ask you this. As far as restrictions and people who can qualify, people who don't, does there have to be a health condition, prone for diabetes or things of that nature, or is this across the board? I mean, we know a lot of people are just using these for cosmetic reasons or whatnot. We talk about all the health benefits with your heart and different things of that nature, bringing cholesterol numbers down. So is there anybody who does not qualify for these new prices?
So what's really shocking today, Chris, is that over 40 million Americans have some form of condition that is an FDA reason to be on a GLP-1. And for listeners at home who may not be familiar with that term, we are talking about drugs that are the blockbusters: Ozempic, Zepbound, Wegovy. All different medications. Some are FDA approved for type 2 diabetics, which is how we got here. But as a result of those type 2 diabetic medications, millions of Americans noticed the side effect, which was weight loss. So we have two categories of those medications. What Americans need to understand is that if what we're talking about here today and with this announcement is specific for weight loss, type 2 diabetics have had this medication coverage. What's groundbreaking is that the government, under Medicare and Medicaid, is extending that coverage to weight loss under this announcement.
So we've already seen some shortages of these medications. Could slashing prices, expanding access make that problem even worse? Or are these companies like Novo Nordisk and whatnot, are they ready to just mass produce?
I would have to think it's both. Like anything, supply and demand. Unleashing this medication, today, 1 in 3 Americans knows somebody in their inner circle that is on a GLP-1 for weight loss. And I always ask this when I do this at my given talks around the country. Chris, do you know someone in your inner world that is on one of these medications?
I do.
1 in 3. So you can take the test to the streets.
Yep.
The more people that get access, that's when medication shortages come. Now, the last interesting point about all this that I've read and understand is that part of the reason that Eli Lilly and others and Novo are willing to do this is the government is promising to have some relief from the FDA approving the new pill form that is yet to come for this condition. So there's a little bit of an incentive for Lilly and Novo to lower the price, which also means there'll be more availability. Well,
that was what I wanted to ask you. What are they getting out of this? Because they don't just come to the table with a price tag of $1,000 a month and say, hey, you know what? If you do it on Trump RX, we'll give it to you for $245, but we don't need anything in return. Heck, one of the Novo executives, practically died in the Oval yesterday. Luckily, he's going to be okay, but that was a scary scene. So what will they get back? Is that the loan?
So as much as I'm a supporter of pharmaceuticals and I love being an American where we have the advancements in technology, there is going to be something that gives. First and foremost, when somebody gets on these medications, Chris, they're not coming off of them anytime soon. In fact, we're seeing when you do come off of them, weight gain is likely. So the first and foremost is that they're going to get a tremendous amount of new patients. The other thing that still remains unclear is how this is going to affect the majority of Americans who are insured through commercial employer plans.
Yep.
This relief has not mentioned anybody that is going to be insured on one of those plans. And that's a big concern for me as we are seeing double-digit increases across America to employers who offer health insurance to their employees.
Great. Rachel, thank you very much. Always good to talk with you. Thanks again.
Thanks, Chris.
All right.